All right, welcome to our broadcast today. I'm your host, Matt Colmia. I'm Executive Director of Digital Strategy for the Providence Digital Innovation Group. As a quick reminder, the information, this video is for informational purposes only. It's not intended to be a substitute for professional medical advice, diagnosis, or treatment. Just want to make sure we establish that out of the way. So let's go ahead and get started. Joining me during this live event will be Sarah Vaezi, Chief Digital Strategy Officer for the Providence Digital Innovation Group. Welcome, Sarah. Thanks for joining me.
Thanks, Matt.
So to kick things off, can you start by talking a bit about what you do in your role with Providence?
Sure, absolutely. So many of you watching today have probably seen me on these LinkedIn Live sessions quite often. So I am the Chief Digital Strategy Officer for Providence, and I work within the Digital Innovation Group, leading strategy, a lot of our build, buy, partner analyses, as well as commercialization of products when we do actually decide to build. So we build new companies and we take them to market, and we're in the process of spinning out our third company as we speak, and should be done with that in the next month or so.
Exciting time.
Yes, very.
So let's start with the big topic sort of our times and start talking about a little bit about COVID. So COVID-19 has had big impacts in basically every industry, and healthcare especially. You know, you've spoken in the past about COVID being the biggest disruptor healthcare has maybe ever seen. We don't really have time today to talk about every downstream impact. I know it's a lot, but just at a high level, what are some of the major implications of COVID-19 that you've seen from a digital perspective?
Sure. And you know what I'll say before I kind of jump right in is that, to your point, Matt, COVID has had taken a tremendous toll on human beings, whether they were patients, the community at large, caregivers, frankly, all of us as people. It's also taken a huge toll on the industry. And so, this is a very big question. And I'll only touch on one very small concept. It's pretty far reaching, but I'll only touch on one part of it. And it will actually be less relevant in the context of like digital, but more just how COVID has disrupted our industry. We did write a series of white papers on specifically the digital opportunities and implications, which I encourage everybody to go to our website, providence-dig.org, and there it is on the bottom of the screen, and you can actually access like the kind of more detail around how we think from a digital standpoint COVID has impacted all of us, and digital for specifically. But I would say, just sort of at the macro highest level, what COVID showed us from an industry standpoint is that the traditional fee-for-service kind of way that we've been doing things is untenable. Some evidence for that, for instance, is that payers were recording record profit, right, throughout the worst parts of the pandemic, when health systems had to shut down a lot of their services from a safety perspective or from a capacity reservation perspective, right? And so payers weren't paying anything, and they were just making record profit as a result. Meanwhile, health systems, providers, a lot of primary care practices are just really suffering. That it's very it's an indicator of a problem when a global pandemic is causing an economic recession that is partly resulting from healthcare providers being so depressed in terms of their kind of overall business and service model. So that's just one example. So we can't. So health system. I just think so. Traditional fee-for-service medicine is untenable. And what we're going to see is, we think, and we've already started seeing this, is the acceleration of two big trends that we've kind of been dealing with in the background for quite some time. One is this sort of consumerization of medicine and of healthcare, which we've talked about quite a bit. And we think that that group of perhaps insured patients, but because of a number of reasons like high deductible health plan penetration and other kinds of things, they're effectively cash pay. And they behave like consumers. So they have choice. They are able to search for care, for instance, in ways like that are analogous to how they search for other services online, as one example. So consumerization in general, seeing huge acceleration. And is value care. And so what I just referred to in terms of payers making record profits and providers struggling, it's really flipping the script on that and flipping the model, so that we don't experience that, and that we're all collectively incented on the hook for better outcomes, reduced total cost of care. And so those two things have tremendous implications for digital, and how we choose to invest, for instance, in products that help our patients find care, access it, make it affordable. And so that's, I think those are the two biggest things that I would highlight, with a lot of implications derived from that.
That's great. And we actually have a question from the chat, and I'd encourage anyone listening in to pose questions related to that as a follow-up. Does this create new opportunities for hospital at home as one particular area of focus?
So it's an interesting question, and I'll actually put it in the context of something broader, which is that we have four areas that we think are particularly important from a digital standpoint to, as we think about digital sort of on that patient or consumer facing front end of the organization. I want to make that distinction because there's a lot of digital potential, for instance, on the back end, back office operations, things like that, that we won't touch on today. And our team doesn't really deal with those things. We deal much more on the patient facing side of things. We have four areas where we are thinking about investing. And when I say investing, I mean investing our time, our resources. In some cases, our ventures team will make investments too. But four areas where we're investing. The first is around distributed care, enabling access and convenience. And that is where we think this notion of hospital at home and just in the home, healthcare in the home, really has a lot of potential about as we think about the pushing care out of the traditional end, which is not that's my son making an appearance in the background.
Hi there, little one.
Here, mommy. As we think about, I'm going to actually put this on hold. Matt, why don't you talk about the four areas and actually talk about hospital home in the context of access? I'll be right back.
Yeah, sure. Happy to. That was a guest appearance from Kaveh, the next health innovation generation of health innovation leaders. So 4 domain areas that we've been talking about as being really focus areas for us and coming into 2021. One is distributed care, enabling digital access and convenience. The second is navigation and personalization. The third is health equity and support for underserved patients and communities. And the last one is integrated, scalable, and extended behavioral health. So distributed care, navigation and personalization, health equity, and behavioral health are really 4 areas we've been focusing on. Within that context, we think of hospital at home as a care model that really enables digital access and convenience and care in the home in general. So hospital at home is one particular model, but we like to think of the possible care opportunities as really deconstructing care into the components that we can then say, which of this can be delivered at home? Which can be delivered digitally, which is better for the patient to be delivered at home digitally, maybe with assistance, maybe maybe bring them in person. But it's sort of raising the question and changing the default from just come into the clinic for everything, literally every touch point, to, hey, let's actually think about what's important to the patient, what's important for their care, and then deliver care that way. So if hospital at home is that correct model for that patient and that care need, that's absolutely something we want to support and explore. Welcome back, Sarah.
Thank you. A little glimpse into day-to-day work from home life. Apologies. But yes, great answer, Matt. And the Providence clinical operations team is working really closely with a number of with our regions, as well as the clinical operations from a telehealth perspective is working closely with our regions and with companies out in the market to build this program, which we think is going to be really a game changer over the long run.
Great. And can you talk a little bit more about what opportunities we're actively pursuing within the access and convenience space?
Yeah, absolutely. I would say the one area where we've actually spent there's actually two areas where we've spent the most amount of time. The first is around, just imagine like the provider, finding a provider, booking a provider, and doing so and making sure that that provider is matched to your needs. So we've made a ton of investments in our provider data and have worked with a company called Kairos very closely, as well as with our own internal digital experience team, to make sure that we have that really great, all the way from the data, the foundational data pieces, through the ability to find a provider, search, match, and book. That's one big area, right? Like whether it be primary care or specialty, it's a really key component to access. The second area, which actually pertains to that, the company that we've built and we're spinning out, is really around provider agnostic care. There is a lot of care that you don't necessarily know whether you need a specific provider, but you just know you need care. Like imagine waking up in the morning and having body ache or having a weird thing on your arm. Those kinds of care are provider agnostic. You just need to see someone that meets your needs, and it could be you could see them in person, you could see them via telehealth, you could chat with them. And so that company that we're going to be spinning out is called Dex Care, and it's really about this notion of access optimization. So matching sort of the demand for what patients are looking for to supply, and navigating patients to the right venue of care that is right for them. And right for them is has a lot of different dimensions. It's the right clinical care. It's the right right non-clinical features, like it's convenient, it's accessible, and it's affordable. So those are the two big areas. And then over time, we're going to get more and more into things like health and healthcare in the home, and a whole host of other things. But those are the two areas we've spent the most time on.
That's great. Let's go to the sort of next domain area and talk a little bit about navigation and personalization. This is obviously a super broad area. There's a lot kind of packed into that. But from your perspective, where are the opportunities for personalization to really shine in healthcare moving forward?
Yeah, so I'll start with a different sort of non-healthcare example, which is that, when most of us, I think most folks who are on this webcast are probably online shoppers in some capacity, right? And most of us probably have some familiarity with Amazon. When you go to Amazon, they don't sell you every single product in their inventory, right? They sell you the things that they think are most relevant to you based on your previous purchasing history. And they have a homepage where it kind of is laid out for you in a contextually relevant way. Now, healthcare, we're not trying to sell people things. We're trying to get them the care and the things that are adjacent to care that impact their health, all the things that impact their health that folks need. And some folks have very limited needs, and some folks have much more complex needs. But surfacing those relevant things up in a way based on the needs of the individual that can be identified through data about them, that's really what personalization is about. And we've started to do that in the context of what we call our consumer engagement platform, which is the Providence app. And folks out there can go and download the app, but you can you can download it on the Apple app Store, or It's available on Android as well. And that app over time is going to be more and more personalized based on what is relevant to our patients. And we've done things like, for instance, integration into much broader set of things. So it's not every single patient has the same needs, and they don't need the same set of kind of third-party integration. So in some case, like for instance, I might need OMADA, which is a diabetes prevention program that could be integrated into our consumer engagement platform via Zelf. Matt, you might need Twistle, which is an engagement platform for pre and post surgery, right? And we can do either of those in a personalized, automated fashion through our consumer engagement platform, and those things can surface up. But the long-term kind of vision is you have a unified access point that is easily navigable, so patients don't have to make their way through without information and without a guided experience, and it's personalized, and so and drives engagement. So engagement is a big part of this, which means like, how often do I actually come back? And the reason why people come back is because it's relevant to them, and so getting that right is going to be really important.
Yeah, and as more and more digital health tools or care access points, whether digital or analog, are offered to the patient, the need to have them all in one place is just so much greater.
Well, and having them all in one place doesn't necessarily mean they exist at the same level of detail all in one place. Access a channel to be able to access them and have that guided experience. So we're not putting the burden on the patient themselves. The more burden we put on the patient, the more friction we introduce, the less likely they are to engage and to kind of stick with it. Friction is very consumer unfriendly or patient unfriendly, and so the goal is like, make it easy so people stick with it. And that that applies to all sorts of things in our lives, and health and healthcare are especially relevant.
That's great. So let's switch to the sort of latter two domain areas that we mentioned, and these are obviously mission critical for Providence and other health systems as well. But I'll talk about behavioral health for a minute. What are some areas where there's opportunity for digital, and why does digital have a role to play specifically in behavioral health?
Well, I think there are a couple things. First, and this is an area where we've partnered very, very closely with our clinical teams. I mean, we partner closely with clinical teams all the time, but this is a highly clinical area unto itself. And so we've partnered very closely with our clinical teams, and Dr. Arpan Wagre, who is one of our key clinical partners in the behavioral health space, has always says this. He says, behavioral health is a highly cognitive discipline, so it's sort of uniquely positioned to be delivered in a digital way versus things that may require that sort of physical connection much more. Behavioral health is highly cognitive and therefore, can benefit from digital. That's one area. I would say another reason is that, behavioral health has been chronically underfunded historically, and digital in general, and I think in this particular context as well, has the potential to more efficiently and scalably deliver on certain things. That it does require investment, but it can really provide much more scalability and efficiency and still deliver that service. And so, in a chronically underfunded space, I think it's got tremendous potential there. And so, so that's, and that's just two of, many, many reasons. Where we've started within that domain is around essentially like sort of that, this is a very complex space, as is everything else in healthcare, but in this particular instance, there are some conditions in particular that are highly prevalent in society, and folks really suffer from them. And there are digital therapeutics that have a huge evidence base that that work, and that shows that they work, and that we can scalably put them in the hands of folks. One example is called cognitive behavioral therapy. CBT is what we refer to it as, and digital CBT has a tremendous amount of data showing that it does work. So that's where we've started, is digital CBT, scaling it across the organization to support folks in a lot of our primary care patients, actually, with cognitive behavioral therapy supporting depression and anxiety. And then we can go from there, right? We're looking at other use cases, like using them in partial hospitalization settings and other settings that, while they may not be sort of in that low acuity bucket, they are still the technology itself can still be extensible to those use cases. So our goal is to kind of put this stuff in the water and give everybody access to low acuity care at a bare minimum, and then triage and navigate them. You'll see a common theme here, to higher levels of care as they need it, so that we're really, our behavioral health team calls it this concept of no wrong door for behavioral health. Yeah. And so that's kind of the next phase of this work. What we're starting with this very sort of narrow, actionable use case.
I love that idea of putting it in the water. I know it's been a challenging time for a lot of folks, and now might be that exact opportunity.
Absolutely.
So onto the fourth domain, a little bit about health equity and support for underserved patients and communities. Sort of a similar question, but what's the role of digital in that space? It's such a tough problem to tackle, and usually very human resource intensive. So where does digital serve as a sort of new opportunity?
So this is it's kind of a tough question. And I'll start by saying it's a tough question because we don't know in many ways. We don't know, I would say in general, a lot of product development, especially in the technology, like I'll talk about technology specifically, has not been built to support traditionally underserved communities. And it not only, and it kind of spans every aspect of the development life cycle. We don't even understand what folks' needs are, right? And so I think that's from a technology standpoint. We have some vague ideas, like for instance, smartphone prevalence is very high, but data availability can be challenging. There are also significant issues with trust and trusting the medical community, because there are many instances of, very, frankly, even mistreatment at a macro level, for some communities. And so there's a lot of rebuilding of trust that needs to occur, a lot of engagement with the community that needs to occur in order for us to just know what people want, know people, know what they want and need, and what matters to them, and then build around their needs and requirements, and not just sort of take this like one size fits all approach. So with all of that, I think, we're working quite a bit to get to know folks. We're going to be doing things called like community inspired digital innovation, where we're getting out in the community to interview folks and to learn from them, and then use that to engage on a level that is appropriate, is linguistically appropriate, is culturally appropriate, and then that will inform future work that we do. In the near term, we're also looking at some things that we have evidence for already that will likely be helpful, like just providing information to folks, like through SMS, for instance, is really helpful. And we'll be doing that around COVID in particular. So COVID, just like what information do you need to know in order to keep yourself safe, around testing, around vaccination, just as a baseline of trying to provide some information to folks who historically, again, haven't had information tailored to them and their needs. So that's where we're starting, but I think it's a long journey. And we need to be very intentional about it. The other thing I will say is that Providence is being very intentional about it more generally, not just from a digital standpoint, but we've committed as an organization through Dr. Rhonda Meadows, who's our head of population health, $50 million toward health equity. So that's it's an amazing start, and so that's where we're kind of building on that foundation.
Yeah, and we had a question come in. But what about patients that are not especially tech savvy? How do we still make sure we're addressing their needs? And I'm going to go shut the door really quick.
Sure. And so we're starting to build on the needs of folks who are not necessarily super tech savvy by doing things that are so we are a tech team, so we do some tech, naturally, but there are different modalities of engagement via technology that don't necessarily require folks to have a tremendous amount of technical expertise. For instance, SMS. So texting is a relatively well understood, easy to engage in kind of modality that most folks are familiar with, right? So we're starting there. We're going back to the concept of friction, trying to eliminate friction. So one thing we learned, for instance, in the earlier days of COVID was requiring folks to have logins introduces friction, and it can make it really challenging for people to do the things that you need them to do. In our case, it was around home monitoring of symptoms when folks were diagnosed with COVID. And so we took out the requirement for logging in and created other ways by which we could validate folks' identity and ensure that there was the right level of security and that kind of thing. And when we did that and we just engaged without login with SMS, we went from less than 10% engagement to over 80% engagement. So just, we're starting to learn just like what works for folks, especially folks who either may not be tech savvy or may have other kind of challenges that prevent them from engaging. So those are the kinds of things that we're starting to do. We don't by any means have all the answers, but we're trying to do these small things so that we can learn and serve better.
Yeah, and to a certain extent, and you've mentioned this before, but tech savvy is not a linear scale, right? Some people are familiar with one technology and not familiar with another technology, accessible through one medium and not through another medium. And we as a health system have not always been great about understanding the nuances of that, but certainly something we're diving into a lot more these days and learning more about.
Yep, we have a great user research and design group that engages very closely, and we have market research teams. We have patient advisory councils. We're using every tool in our tool belt to know people better and get more sophisticated about the way that we think about segmentation and then designing and serving as from there.
Great. We've only got a couple minutes left, so just as a sort of a final question, is there anything else you're excited about in 2020? Anything else, or 2021? Anything else you're excited about, or do you want to add that we haven't covered?
Well, first, I'm happy that 2020 is over, and so I'm excited about. I'm excited about I think a lot of the things that we've talked about and that maybe have been sort of in the backs of our minds or haven't had as much traction, whether it be the movement toward value, which I know Providence is making very significant intentional moves in that way, or whether it be our commitment to health equity as a society, as organizations, or as individuals. I just think it's we've kind of reached an inflection point that I'm very excited about. And I think it will have a lot of benefits for the way that we think about technology. I think we'll see a lot of companies coming out that are much more focused on health equity. There's a group called Health Tech for Medicaid that is actually Medicaid and health equity, by the way, are not synonymous with one another. They're separate issues, but there's certainly some relationship there. But I think we'll see more and more of these kinds of organizations as well as specific companies tackling these issues in a really meaningful way, and we'll be able to bring a lot of these things to scale. So I think 2021 is going to be an exciting year for that.
That's great. Great way to end it. So thank you, Sarah, for joining us today, and to everyone for listening and sending in your questions. To learn more about any of our initiatives and programs and services, ways to give, or if you're looking for medical care, you can go to providence.org. The digital innovation specific website is providence-dig.org. And make sure to follow us on social media at Providence Health System for LinkedIn, Facebook, Instagram, and under Providence on Twitter. Thank you, everybody.
Thanks, Matt.